Hi everyone, it's Dr. Haddad, the Chief of Staff at the hospital. Hope you're doing well. I just want to answer some questions about COVID vaccines today. I get asked many questions about this, and certainly please feel free to reach out to the Public Health Unit, which has a wealth of knowledge about COVID vaccination. Some of the frequent questions I get asked is things like, should I get it if I'm contemplating or I'm pregnant? The guidelines, the official guidelines from Society of OBGYN is it's safe to do so to get it during pregnancy. Now you have to. My advice is to talk to your obstetrician or midwife about this, and certainly the public health unit. There's no issues for sure getting it during the second and third trimester, and while it's safe in the first trimester, many advise to wait till you get into second trimester because just in case there's any issues during the first trimester, which is the highest risk of pregnancy as the organs are developing. If there's any natural phenomena, you don't want to mix it up with potential side effect of a vaccine, so they try to avoid vaccination the first trimester. But I think it's best to just speak with your obstetrician or midwife about it. But overall, it is safe and it is recommended to be given, especially when the COVID incidence is high. So you have to balance it with the risk of where you live and incidence as well. They have seen many really ill pregnant moms and in the GTA during the latest COVID pandemic, and it was quite sad to see. The second question I get asked is about immunosuppression status. So if you're immunosuppressed, should you take the vaccine? Absolutely. If anything, you might need even more boosters. The vaccine works by teaching our immune system how to respond to the virus when we're exposed to the virus one day down the road. And if you're immunosuppressed, either because of natural illness or because you're actively being immunosuppressed with medications, then the immune system might take some time to actually build up immunity and antibodies and develop memory cells. So the latest studies actually from a couple of days ago showing that the organ transplant patients who are heavily immunosuppressed need even a third booster, for example. So definitely, if you're immunosuppressed, it's more of a reason to actually take the vaccine. Would I take it myself? Absolutely. Both myself and my wife actually have taken the vaccine, and I recommend it to anyone I know. Should I? Do we know much about vaccines in the long term? Well, while no one can look 20, 30 years down the road, we take all kinds of vaccines all the time, MMR, TD, influenza, etc. And vaccine side effects usually happen actually in the first week to 2 weeks. The AstraZeneca had a small 1 in 50,000 chance of developing something called VITT, which is blood clot disorder. 1 in 50,000 that developed up to 21 days. So that's as latest, as long as you go in terms of complications. But most people have, if they have any side effects, usually in the first week. And that includes local arm pain, myalgia, feeling a bit tired, maybe mild fever, etc. But in terms of long-term side effects, that shouldn't even be there because the vaccine by itself actually doesn't last that long. mRNA vaccine, for example, the RNA is not very stable, it goes into the cells. It teaches our cells to make portions of the virus, the spike protein. The immune system sees it, it attacks these cells and produces antibodies and memory B cells and T cells. So that just in case down the road you see a real virus and the immune system knows what to do. But the actual components of the vaccine are long gone by then. And one more question I get is, well, if I had COVID, do I need a vaccine? Absolutely. The COVID natural immunity developing from COVID itself is good protection, actually, but if you take a vaccine, it boosts your immunity even more. And some of the studies I looked at show 25 times increase in antibody titers. So, and as we have various variants developing, you might have been infected, for example, with an alpha variant, the UK one. But now the Delta is taking over as the new one. Nevertheless, there's cross immunity as well. But taking a vaccine will provide a much boost to the immune system. So yes, you are advised to take a booster. If you have any more questions, feel free to reach out to either myself or the public health unit and our Lambton Public Health has a lot of information about vaccines and latest information. In the meantime, please stay safe and enjoy the summertime.